Thank you, Mr. Speaker. And my question this morning is to the Attorney General. Yesterday, I was very pleased to see the AG defending the principle that every woman in this province has the fundamental right to make her own decisions about her health care. I am certain that every member in this legislature would also agree that women have the fundamental right to access health care without fear for her safety, privacy, or dignity. I speak for my constituents when I say that I was terribly disheartened to hear of the acts of the harassment and intimidation directed at Ottawa women exercising their right to choose. Speaker, that kind of hatred, aggression toward women is absolutely unacceptable. That is why I was very pleased to hear that the government intends to introduce legislation that would create safe access zones outside abortion clinics and ensure women across Ontario have safe access to health care services. Can the Attorney General inform this House about the government's planned legislation to be introduced this fall?
Thank you. Attorney General.
Thank you very much, Speaker. I really want to thank the member for asking a very important question. Speaker, this is an important issue to me as both as a citizen of Ottawa and as a person who has always been a strong believer in a woman's fundamental right to choose. Speaker, it is also my steadfast belief that every woman in Ontario has the right to make decisions about her own health care, and she deserves to do so freely, without fear for her safety, privacy, or dignity, without fear of being judged or publicly humiliated because of a choice. Speaker, without fear of being threatened with violence, harassment, or any form of intimidation. Speaker, no woman should have to take such things into account when making her own healthcare decisions, and that is why, Speaker, this fall our government will introduce legislation that will propose to create safe access zones around specified healthcare facilities to protect the safety and security of patients, staff, and visitors.
Supplementary.
Thank you, Speaker, and I would like to thank the Attorney General for his response. I know many people across this province would agree that this is an important issue that touches every woman and goes beyond economic, cultural, or geographic differences. All women across this province have fought and laboured hard throughout the years to build up this country and province we can now call home. A woman's fundamental right to choose is one that should be enshrined and protected under the law. In fact, I understand that Newfoundland and Labrador and British Columbia are among the few jurisdictions that have legislated safe access zones to ensure protection of healthcare centres and women. I believe that our government will introduce strong protections that guarantee much-needed protections for healthcare centres across this province. My hope is that the members opposite will support the government's actions to ensure women in Ontario can continue to exercise their fundamental right. Can the Attorney General inform this House on our government's next steps?
Thank you. Attorney General.
Speaker, thank you very much. The member is correct. British Columbia, Newfoundland and Labrador and province of Quebec have implemented similar laws in their provinces over the past decades. Speaker, these laws provide for protection to all women and healthcare providers in those jurisdictions. Over the summer months, Speaker, my ministry and I will continue to look at laws passed in other jurisdictions, and we will consult with legal and healthcare experts, advocacy groups and local clinics to determine the details of the proposed legislation. Speaker, we have a lot of work ahead of us on this very important issue over the next few months, and I believe that policies like this are more important than ever. Speaker, I commend and salute all champions of women in this House. I know that they all believe that this is not a partisan issue. Speaker, I know that they all believe that women have a right to choose, to make decisions about her own health care. And I'm confident, Speaker, and I hope that all members will support this very important legislation when it's tabled in the question.